It was not mentioned, the new insert you can get in glaucoma surgery, the stent for eye drainage. Is that something that you do at UW?
Yes, it is. There's actually quite a few stents that have now come out. There's the eye stent, which was the original kind of small drain that we place, and there's actually a version 2.0 of the eye stent as well, the eye stent inject. We're doing both of those at the UW, as well as some other stenting procedures that are newer to kind of decrease the complications or the risks of surgery, that they might have some benefit for patients that don't need quite as low a pressure.
I have a question about computer screens. How does the light affect your eyes?
So that's a very good question. The computer screen does emit more of a blue light part of the spectrum. The study is inconclusive if in the long term if it is damaging to the eyes, but things you can do to reduce the glare is just, play with the settings on your computer screen. A lot of glasses have coatings for them too, like Crizal has the Preventer coating, which blocks about 30% of blue light. Also, there's another lens called Blue Tech lens. I think Kodak also has a lens as well, which blocks about 80% of blue light. You do get a little bit of brownish tint to the ones that block out more blue light, but those are things you can do to protect your eyes from that harsh blue light from the computer screen.
I guess I'd like to know why they can't just increase the magnification on my glasses.
So with any kind of eye disease, because it's affecting the retina, especially with macular degeneration, it's almost like there's pieces of those photoreceptors that are now missing because they're dead. And so glasses can't help to fill in those spots that are missing. But what glasses do is, some glasses do help with magnification. Depending on what kind of blind spot or the type of macular degeneration a person has, that glass extra magnification can help make the print size larger than that blind spot, so it's easier to recognize the words that you're reading, so that it's easier to continue reading. But depending if that blind spot is much larger and it's too much magnification that's needed, it's physically impossible to give, or it cannot be fabricated, then having more wearable technology or video magnifiers are the next level.
Thank you.
I'm going to step one quick follow-up with that, too. If you think functionally walking around with that magnifier in your glasses, it's really unsafe. If you remember the cartoon with Mr. Magoo with the big, thick glasses, he was always walking off cliffs and in front of cars and things. So the thick magnification just doesn't work in glasses for a safety reason, too.
I have a question. What kind of phone do you recommend, like a cell phone that's for someone that's visually impaired? Do you have any recommendations that's easy and accessible?
One of the easiest cell phones is the Jitterbug phone. That has the largest screen, the largest font on the screen that I've been able to find for people with vision impairment. They're also can be very, very easy to use. You can open it and it goes directly to your address book, and we'll read down the address book to make phone calls. Most cell phones now, if they have a screen on them, the smartphones can be adjusted. You might need some advice from a vision rehabilitation person, or if you've got a family member who's really good with phones, there are adaptations within those phones that can make the changes in large print or contrast, or also have those phone numbers read out to you. But in general, the Jitterbug is the best that I've found.
I have a question about having surgery if one has two conditions, cataracts and dry macular degeneration. I've heard that surgery on cataracts can cause dry mac to become wet mac. Are you familiar with any updates on that?
So I can give my best answer. I usually actually defer to my macular degeneration colleagues when making that decision. But basically, we're doing cataract surgery when we think we can get better function after the cataract is removed. So that's usually my limit of when I'm willing to do cataract surgery. If I think I can improve the vision, then usually it's worthwhile. There have been some studies, and maybe Barb can make a comment, but there have been some studies that show that dry macular degeneration sometimes does switch to wet after cataract surgery. But I think some of those have been inconclusive, and there's been kind of back and forth on that. So generally we treat based on how bad the cataract is.
Yes, studies that have looked at that chance that cataract surgery could make the macular degeneration worse based on large populations of patients. So looking at what happens over time. And most of that came from years ago. So some that information is because those patients have been followed for a long time. One big example is Beaver Dam. So Beaver Dam, Wisconsin is quite well known because patients have been followed for decades. But in today, in 2018, cataract surgery is much different than it was even 5 years ago, 3 years ago. So it's safer, it's faster, there's almost no inflammation, there's no sutures, there's no blood. So that now, in my opinion, the chance of making the dry macular degeneration worse is very, very low. If someone does have injections, we can also do cataract surgery as long as we time the injections for wet macular degeneration carefully with the cataract surgeon.
Hi, I have several questions regarding glaucoma. I at first was diagnosed with glaucoma at 36, and it was right after I had my first child, and I had liver problems during my pregnancy. Now, from Western medicine, I've been told there's no correlation between liver problems and your eyes, but with Eastern medicine, I have seen, they do have a correlation between that. So I'm wondering, so I have several questions. Do you know anything about the liver problems and leading to glaucoma? And then I've had 7 surgeries. On each eye I had trabeculectomy, and then they both failed after about 4 years. One collapsed, and then the other one just got blocked up. So now I have a shunt in one. Now the scar tissue has gone over the end of the shunt. And so I'm still using drops, and I've become allergic to all drops except 2. So I'm wondering what anything happy I can look forward to with that. Like, can the scars be undone, and are there better drops being, forecasted here?
So to answer your first question, I do not know of any association between liver disease and glaucoma. I don't think anything has been seen in, again, those bigger studies that we look at of populations. You obviously have a very aggressive form of glaucoma because you're kind of in that younger age range when you were diagnosed, which usually does mean that the prognosis is not as good, so you've required multiple surgeries. Unfortunately, our glaucoma surgeries tend to fail over time. And so what we find is that the drainage doesn't continue, and since we're only really treating for the eye pressure, and there are other things at play that probably make the glaucoma worse, the degeneration of the optic nerve worse, getting the pressure down is our biggest goal, but that doesn't cure the disease. It's just a management strategy to keep the disease from getting worse as best we can. Of note, there are newer surgeries that are becoming available, but unfortunately they tend to be for more mild to moderate glaucoma. But there are newer things like an external laser that's now available for more severe disease that's pretty well tolerated by the eye. So we do have some newer things coming out. And there are 2 new medications that have come out in the past year. So there are 2 new medications that one came out in January called Vyzulta, and one came out in April called Repressa. So these are actually the first new medications in the last 30, actual true new compounds in the last 30 years. So that's pretty exciting that science is kind of leading to some new discoveries, and those are eventually making it to our clinics.
I was diagnosed with dry macular degeneration about 5 years ago, and around the same time frame, I started having issue with dry eyes.
And about 3-4 months ago, I was diagnosed with an autoimmune disease, Sicca syndrome, which the main thing is Sjogren's. So I guess I'm just curious if there is a connection between the two of those and what I could possibly do.
So I think as far as the dry macular degeneration and the dry eyes, that is just a coincidence. There's really no association between those two problems. There is a big association between people who develop Sjogren's and Sicca syndrome and autoimmune diseases along with dry eyes. Dry eyes is a very common problem to have with those autoimmune diseases. As far as, I think your last question was just kind of what can we do about that? And unfortunately, dry eyes is a chronic problem, and especially people who have autoimmune disease, it can be a very tricky problem to treat. I actually, when I have severe dry eye patients, I actually bump them over to our cornea practice, our cornea specialists, because they have a little more specialty and they can actually use specialized medications, and they have a little more available that they can try. But unfortunately, it is a chronic problem that requires treatment. Sometimes the medications used to treat the actual Sjogren's actually help with the dry eye as well.
Hi, this conference has been great, but I have a question for you. I was diagnosed with RA, rheumatoid arthritis, about 6 years ago, and then with macular degeneration, which is in my family a couple years after that. Have you found any correlation between the drugs that people take for RA, that it's going to adversely affect macular degeneration?
The one medication that's often used in rheumatoid arthritis is Plaquenil. Plaquenil is very good because it helps decrease inflammation in the joints. There may be some effect in your macula from Plaquenil, so that the same area, the same region in the retina. It's not related to the macular degeneration, but we do want to see patients that are on that medication once a year. So there can be some overlap because there's retinal problems can occur in the same part of the eye, the macula, but they're not related to each other. Those two diseases are not related.
Thank you. This conference, it has been good. What do you think of the yellow-tinted glasses for night driving? Are they affected, or do they make it more difficult?
I know there's been a very recent study, and some eye doctors will recommend against using yellow at night because it is blocking light coming into your eye. It's blocking the glare, but it's also blocking helpful light for driving safely. Anecdotally, there are people that can find some yellow glasses that can work pretty well. I think it's, if you wanted to try it safely in your neighborhood and see how that works, but do keep in mind that any color you're putting over your eye is blocking anything, some of that light coming in that might keep you safe as you're driving.
I'm just going to follow up on that as well. So the yellow glasses are helping reduce glare. That's why a lot of people like them for driving at night. But also it can skew your color perception. So you want to be cautious when you're purchasing these glasses that they're actually approved for night driving, and they'll mention that you don't want to just get any kind of yellow filter, and that way you can still recognize the traffic signals distinctively as well. Because it reduces glare, people find it comforting, but as Amy mentioned, it does take away from what you're seeing as well, because it is a filter at nighttime. So you want to keep that in mind as well.
Hi. Kind of two questions. For people that have dry eye and do not have macular, what kind of drops are you recommending? I've gotten different conflicting info from different eye doctors. And then if somebody has macular and is doing the drops, are there, again, the recommendation all individualized for each person and same for both cases? So all the drops that are on the market are really quite overwhelming on trying to figure out what's the best.
That's a $1 million question, I would say. So the reason that it is overwhelming, and when you go to the store, when you see that many products for one thing, it means that no one product, it works 100% of the time, and may not even work 50% of the time. So there is some individualization there, but it's also just that you need to keep with it. So what I usually recommend to my patients, I do an eye exam. I look to see what part of the tear film is not working well. So are they not producing enough tears? Is there inflammation of the eyelid? And then that can kind of help us direct what kind of drop might work better. Some of them have a lot of oil in them, so that it actually replaces some of that oil production that might be missing in patients with meibomian gland dysfunction or blepharitis. And some of them are just liquid, kind of very, very a liquidy substance. Some of them are gels that last on the eye longer, or ointments that you can use right before bedtime that kind of help with that early morning dryness or overnight dryness. So that's the reason there's so many options. So usually kind of a specialized exam will help with that.
I've had extreme light sensitivity since I had cataract surgery. I wondered what caused it and what could be done about it. Thank you.
So I'm sorry that that happened. I would say that's not common, that most patients feel that they, for a while, usually they notice that improved or that increased lighting, and that can be a little overwhelming, especially if you had dense cataracts and you go to a clear lens, all of a sudden there is a lot more light coming in. Generally, we try to say that that's a good thing because a lot of light helps you see well, but sometimes if it feels like it's causing headaches or just light sensitivity, that can be difficult. And so I would say in general, I usually recommend treating for any dry eyes. So if the eyes are dry or irritated, that's also going to make you very light sensitive, or if there's inflammation around the eyelids, I usually treat for that. And then I turn to my colleagues usually and ask for help with kind of sunglasses or something that might help reduce the amount of light that's coming in, or picking lights that might be more gentle on the eyes.
I'd like to pass on a tip from my optometrist for my dry eyes, and drops weren't helping. He suggested a hot, wet washcloth over my eyes in the morning for about 15, 20 seconds. Hot to the point of not painful, but hot. And that seemed to open up some of the oil glands on my margins of my eyelids and did a very good job. So cheap, no side effects, safe.
Absolutely, and they do have those commercially available if you wanted to pay for them too. But I agree that the warm, I frequently talk about the warm washcloth, the warm compresses, and that's a very good solution. If you have a lot of problem with oil glands, also fish oil can sometimes help, or omega-3s to kind of produce better oil.
All right, we have time for one more question.
Can you explain ozone therapy?
Ozone therapy
For macular degeneration.
I'm not familiar with that, so yeah.
Too much.
I'll look it up. That sounds like something new. So, one last question back here. The light boxes for seasonal affective disorder, how does that affect your eyes? I've been told it's best not to really look right at that light. So you want that light shining on you, you want to be in front of it, but try to keep from staring right at it. So it's not that it has to be right on your, directly in front of you, staring at it, but just you're bathing in that light. Right. So I'd like to thank our speakers. Wonderful job.